Good afternoon, everyone, and welcome to today's WorkSafe Tasmania Month webinar, Engaging in the Smoking Conversation and Helping Smokers Quit. I'm Stephanie from WorkSafe Tasmania and also the coordinator of WorkSafe Tasmania Month. I'll also be your moderator for this afternoon's session. Before we do commence the webinar, I'd appreciate you taking a few moments to read over the following slide, which gives information about the webinars delivered during WorkSafe Month. I'd now like to go over how you can participate in today's webinar. So we've taken a screenshot of an example of the attendee interface. You should see something that looks like this. You should see something that looks like this on your computer screen in the upper right-hand corner. You're listening in using your computer's speaker system by default. If you'd prefer to join over the phone, just select telephone in the audio pane, and the information to dial in will be displayed. You will have the opportunity to submit questions to today's presenter in the question pane. Please do submit your questions at any time during the presentation. We'll collect these and address them throughout the webinar. We're also recording the webinars during WorkSafe Tasmania Month, and we'll make those webinars available on the WorkSafe Tasmania Month website after WorkSafe Month finishes. Lastly, once you do leave today's webinar, you will receive a survey on the presentation, and we'd appreciate you taking a few moments to provide us with your feedback about your webinar experience and also about the presentation that you're about to hear. So it's my pleasure now to hand you over from Health and Wellbeing Training Consultants, Stavrula Sanders, to present this afternoon's webinar, Engaging in the Smoking Conversation and Helping Smokers Quit. Welcome, Stav.
Thank you, Stephanie, so much, and welcome to all the participants today on this interesting and very important webinar. I'm very excited to be sharing my smoking cessation knowledge and experience with you all today. Just to give you some background, I have a background in psychology and counselling, and I worked for Quit Victoria, the Cancer Council of Victoria, for 20 years in tobacco control, and I worked in a range of roles, including quitline counsellor, but also as an educator running quit seminars and groups in the workplace and community setting. And more recently, I trained health and community professionals to support their work in encouraging their smoking clients to quit. And that's what I'm going to be covering today, how you can engage in the smoking conversation with your staff or clients and how you can support them along the quitting journey. I've trained a range of health professionals from different settings as well as community professionals, including midwifery, mental health professionals, chiropractors, Aboriginal health workers, and so on. I now run my own training and education business, which focuses on a range of health and wellbeing topics, including quitting smoking, which I'm very, very passionate about. So in today's webinar, what I will be covering, we'll be starting off by highlighting the important role that you play in tobacco control. We'll be looking at addiction and how we can better understand smoking behaviour and the stages of behaviour change so we can then better engage our smoking clients or staff. We'll look at how we can engage staff and clients in the conversation and quite quickly. I acknowledge that most of you don't have a lot of time to spend on having this conversation, so we'll work through a particular framework, a well-recognised framework, where you can engage in conversation quite quickly. And then we'll finish off by looking at the various quitting medications, including electronic cigarettes, and where you can go to for further information support for yourself, but also for your clients if they're wanting some additional information. But before we begin, I'd like to get to know you a little better. So if you could please type in the chat box to your right your role and your interest in attending today's webinar. So for example, you might be a staff member who's coming along to support staff or colleagues or possibly a loved one at home. You might be a manager on how to support your staff, your colleagues, or you might be a particular health or community professional. I'd really like to know where you've come from today, and I'll tailor the information as I'm presenting to you. How are we going, Stephanie? Do we have any responses?
So responses coming through, Stav. We've got a campaign manager, enrolled nurses at a GP, safety team to help motivate workers to make their own decision to quit smoking, WHS employee at a university. We've also got a health and safety coordinator.
Great, great. Thank you so much, everyone, for joining in, and welcome to today's webinar. I hope you find it useful and practical so you can actually pass on the tips and ideas that I'm going to share to your smoking clients and staff. And I'll use those words interchangeably, staff and clients. So let's begin. Why do we even need to address tobacco? Why do we need to keep it on the agenda? And why do we make such a big deal about it? Well, unfortunately, every year in Australia, 2 in 3 long-term smokers will die prematurely because of their smoking. And we know from the latest research that a lot of these deaths occur in middle age, but on average, smokers will die 10 years earlier than their non-smoking counterparts. Now, this is quite heartbreaking. If you know 3 people who smoke, that possibly 2 out of those 3 will die prematurely. We know that smoking is one of the leading causes of preventable disease and premature death. And having heard and seen these statistics, what do you think about that question that I've noted on the slide? Do you think it contributes to more deaths than alcohol and illicit drug use combined? So either type yes or no in the chat box to your right, and I'll pull up the slide in a moment. How are we going, Stephanie?
So
Any yeses or nos?
Yeah, no, certainly looks like a definite yes, and one response has come in saying no.
Okay, great. Well, thanks, everyone. Well, surprisingly or not, depending on how you've answered, we know that this does actually, tobacco is the biggest killer in Australia. So even when you do combine alcohol and illicit drugs, as you can see there, every year in Australia, over 15,500 people will die from a smoking-caused disease. It does contribute to more drug-related hospitalizations than alcohol and illicit drug use combined. So what can we do? Well, let's firstly start by acknowledging the important role that you play as the health worker, as a community worker, as a staff member. We know that health and community professionals are highly respected, they're very knowledgeable, they are a reliable source of advice and support, and clients are receptive to receiving health messages, and in particular about how smoking affects their health. And this is very much part of our professional duty of care to clients and staff to inform them and support them along their quitting journey. We also know through the latest research that smokers are more likely to successfully quit with the help of their health or community professional. And that could be someone like their local nurse or doctor, it could be their mental health caseworker, it could be the quit line. And we'll talk more about the importance of support as I take you through the webinar. We also know that you don't need to engage in conversation for too long. Even if you offer as little as 3 minutes of advice, this has shown to have clear benefits for the smoker. They're more likely to make a quit attempt, their confidence increases, and they just feel much more encouraged to have another go. So let's have a look at this in a little more detail. What we're aiming to do with smokers is to constantly engage in the conversation, because we know that the more times we engage, the more likely they are to make a quit attempt. And the more attempts they make, the more likely they are to be successful. With all the work that I've done with smokers, and I've spoken to many, many smokers over the phone and in groups and running focus groups, smokers often tell us, when my smoking has not been raised by my health or community professional, well, I just assume that it's okay to smoke, and so I keep on smoking. So even smokers themselves are expecting their professional to check in with them and ask them about their smoking and encourage them to have a go. Just by having this conversation, this does build their confidence, and we'll talk about how you can do that, again, as I take you through the webinar. So let's look at how we can encourage and support smokers through the quitting process. A very important part is helping your smoking clients and staff understand the power of addiction, but also understand that we often go through a series of stages when we're making any type of behaviour change. Now, smoking for many people plays an important role. It has a purpose. So why do you think people smoke? What role do you think smoking plays for your smoking clients or staff? Have a think about your clients or staff and type in some of your answers in the chat box to your right.
Just while those responses are coming in, a question has come in, Stav, just saying, what if you aren't a health professional and do not have that expertise?
That's okay. Even though you're not a health professional, don't have the expertise or don't have the qualification, I think it's still very important to engage in the conversation, and you're coming from a position of, I care about you and I'm really concerned about your health and I'd really like to help you. I acknowledge it's your decision, and I acknowledge that this decision is one that you need to make, but I'm here to offer you the information and support you along the process. And as I take you through the international framework, I will actually highlight some of these key steps. So regardless of whether you are a health or community professional, just by engaging, just by checking in can make a difference to a smoker's quitting success.
Okay, thanks. So responses that have come through in terms of why you think people smoke, we've got coping with stress, extra breaks, social, avoid eating. Again, stress has come up a couple of times. And it's one of the responses they enjoy it despite the downsides.
Absolutely. You're all spot on. You're all valid reasons, and you've highlighted pretty much all the reasons why people smoke. And people will smoke for a variety of reasons. So, but most people we know often smoke to help them cope with stress or as a form of relaxation. Often they're socializing with colleagues, friends, loved ones, often around drinking and caffeine. Weight, for many smokers, there is that fear of putting weight, and often they smoke to manage their weight or suppress their appetite. For others, it's about helping them manage their moods. So they may have anxiety or depression, and they may feel nervous or anxious, and so often they smoke to help manage those moods. For some people, it is very much about time out. So they take some time out of the workplace. They may be taking some time out away from the kids, or maybe a confronting conversation, and often they can walk away and say, well, I'm just going to go outside for a smoke. For some people, it is very much about boredom, so filling in that time. And often when I'm working with smokers and boredom comes up, I really encourage them to think about what else they can do instead of smoking to fill in that time. Because when you do give up, you will have an additional 2.5 hours extra time during the day if you smoke about 20-25 cigarettes per day. For some people, it is very much about bonding, and we know this in some cultural groups that they smoke together, they share their cigarettes together, they socialize together, and so that's an important factor that also needs to be considered if you're working with particular groups or working with young people. But we know for most smokers, it is the power of nicotine addiction that drives their smoking, and often the reason why they cannot give up smoking. So let's have a look at addiction further, and we know that addiction is made up of the following three parts. That most smokers will be physiologically dependent on their cigarettes, and we'll look at these three parts individually. We know that for most smokers they have particular triggers and cues. For some of them it is very much about their emotions and learning how to manage their emotions, often without smoking when they're quitting. But for most smokers, often they find that it's very much a habit or routine, or that they've done it over and over again for 5 years, for 10 years, for 30 years, that it becomes part of who they are, and often they do it unconsciously or without even thinking. So let's have a look at these three parts individually. So we know that the tobacco plant naturally contains the chemical nicotine. Now, nicotine in the tobacco plant actually plays an important role. It's actually an insecticide. It's an insect repellent. So it prevents the insects from eating the tobacco plant. When you put this in a cigarette, however, it creates a range of changes to the physiology of the body. It creates a range of changes to the brain chemistry, and we'll look at those in a moment. And we know from years and years of research that it is often nicotine that drives the addiction in smokers. It is often nicotine the reason why people cannot quit smoking, and often try many, many, many times without success. Yes, you do meet a small proportion of the population of smokers who can quit and then can have the occasional cigarette, like one a year or one every so many months, and then they remain quit, they go back to quitting. But for most smokers, we do know that if they do stop smoking and they have that just one cigarette, that will lead them often back to their full-time smoking. And we know that when you smoke, nicotine reaches the brain very quickly. So here's another question for you to think about. How quickly do you think nicotine reaches the brain? So when you inhale that first puff from a cigarette, type in your answers in the chat box. Do you think it's seconds, minutes, hours? What do you think? How quickly do you think nicotine works or reaches the brain?
So seconds, basically, within a few seconds, 10
Seconds.
seconds, yeah, seconds is...
Seconds. Excellent, guys. You're on the right track. We do know that nicotine reaches the brain within 7 to 19 seconds. So it works very, very quickly. There is no other product that can deliver nicotine as quickly as these cigarettes do. It's a very efficient and effective nicotine delivery mechanism. So what happens then when it reaches the brains? Well, a number of chemical reactions happen, and dopamine in particular is released, and dopamine is a chemical that makes us feel good. We feel pleasure, we feel reward, we feel comfortable, we're able to go about our daily activities. But we also know that it can make us feel much more alert and can stimulate our memory. So nicotine is actually considered a biphasic drug. It's a mood-altering drug that is biphasic. It both stimulates us, but it can also relax us. So stimulates us in terms of making us feel more alert if we need to go into a meeting or about to concentrate because we're studying for an exam, or it helps us relax so we feel less stressed, and it just has that calming effect. However, these effects are very, very short term. They do decrease within minutes. Now, for a lot of your smoking clients, they might say to you, well, I feel these effects much longer than a few minutes. And this is because of these emotional and habitual triggers that I'm going to discuss in a moment. So physiologically, we know that these effects, both the stimulation and the relaxation, decrease within minutes. Because in fact, what we do know is that when you smoke, you actually put stress physiologically on your body. Your heart rate increases, your blood pressure increases, some of your muscles tense up, and overall your body's now working in overdrive. So yes, you may be feeling quite relaxed and calm and content, but physiologically the body is working in overdrive. So let's come back to practicalities. You're working with a staff member, you're having a chat with your client about their smoking, and you want to assess if they're nicotine dependent. I think it's really important that you ask them these key questions. Do you smoke within 30 minutes of waking? Do you smoke 10 or more cigarettes a day? And if you've quit in the past, have you experienced cravings or withdrawal symptoms? Now, if your staff member or client answers yes, just yes, to one of those questions, they would be considered nicotine dependent. And if they are nicotine dependent, I would be encouraging the quitting medications to help relieve those cravings and withdrawal when they give up smoking. So it's a very quick, efficient test that we can check in with our smoker when we're working with them to acknowledge their nicotine dependency. Even some smokers find this information very surprising. They might say, wow, I always thought that my smoking was more of a habit than actually an addiction. And often when I'm having that conversation with smokers, I say to them, well, how long can you go for without having a cigarette? Can you last for a few hours? Can you last for a day? Because we know that most smokers, especially who are highly dependent, will often relapse quite quickly. And we'll talk about relapse in a moment. We know that a strong marker of nicotine dependency are the experience of cravings and withdrawal symptoms, and we know that most smokers will experience withdrawal even if they go for a short amount of time without smoking. It is often withdrawal that leads people back to their smoking, and it is often withdrawal the reason why people don't start quitting in the first place. So let's have a further discussion about withdrawal. Thinking about your smoking clients or staff members, or if you've ever been a smoker yourself, or possibly you are a current smoker, what are some common withdrawal symptoms? What do smokers experience when they stop smoking or when they go for a period of time without having cigarettes? Type them in the question chat box, please.
Shakes, anxiety has come up, tingling,
Yes.
agitation,
Yep.
mood swings,
Yep.
short-tempered.
Yes. Yes. Great. Yep. all of those and more. Now, not every smoker will experience every withdrawal symptom. As each person is an individual and their smoking is, individual, whether they've smoked for 5 years or 30 years or whether they smoke 5 a day or 50 a day, the symptoms will vary from individual to individual, but you're very much spot on. For most smokers, they will experience this restlessness or agitation or anxiety, this sense of loss, having lost their best friend. For some people, they're not able to sleep or they can't get out of bed. They feel quite fatigued and tired. For others, they have these tingling sensations in their hands and feet, which is a good sign that their body is healing and recovering. For others, they cough. They may cough up black phlegm. This is a good sign that your body is cleaning. Others have flu-like symptoms, and often your smoking staff member or client might say to you, well, I was better as a smoker. I never coughed. I never had flu-like symptoms. I never felt restless. I didn't experience anxiety to such a degree. What's the point of giving up when I'm experiencing such painful symptoms? I think I'll just go back to smoking. What is really important is that we have this conversation with smokers, that we inform them that yes, you will experience these symptoms, but this is a good sign that your body is healing, your body is recovering and is learning to live life without nicotine. So I like to refer to these symptoms as recovery symptoms. Your body's recovering, your body is healing. It's a good sign that nicotine is excreted or is leaving the system quite quickly. We know that nicotine leaves the system within 12 hours and all its byproducts within 5 days. So this is a good sign that your body is coming back to normal. How long do these symptoms last? Well, again, it is very individual. They do tend to peak within the first few days to a week, but then they do taper off as time goes by. But often we say on average they last between 2 to 4 weeks. So encourage your clients to hang in there. They will feel better. And I've provided a handout for you with some tips and ideas to help your smoking clients and staff get through cravings and withdrawal. Just to have some ideas about what they can do. Due to time constraints, I'm not able to spend a lot of time here on dealing with cravings and withdrawal, but I do want to acknowledge that cravings will pass within 2 to 5 minutes. So 2 to 5 minutes. If your client is saying, rubbish, my craving is lasting longer than that, this is very much psychological. This is very much an emotional trigger and possibly a very strong habitual trigger. But physiologically, cravings will pass within 2 to 5 minutes. And that handout has lots of tips and ideas that you can encourage clients of what they could do in 2 to 5 minutes. It's also important that clients come up with their own ideas and strategies, because you might offer 1,000,001 suggestions and go blue in the face thinking about ideas of what they could do. But these ideas and strategies need to come from them, and often it's about trial and error, and often it's learning from previous experiences and looking at what has worked and what hasn't worked. So we know that nicotine addiction is a very strong component of the 3 aspects of addiction, but we also need to address the emotional triggers and the habitual triggers, because for a lot of smokers they may be using the quitting medications, but they might also be feeling quite lonely, quite anxious. They might be feeling stress. They might be feeling this strong urge to smoke when they're socializing, and often this is the reason why people struggle. It is more than just a habit, and it is a lot more difficult than just stopping because your doctor has asked you to, or because your family and friends are encouraging you to, because nicotine is such a powerful drug. So let's have a look at habitual and emotional triggers. We know that there are certain behaviors or routines that are linked in with cigarettes. Again, think about your smoking clients or staff, and what could be some of these possible habits? What are some habits that are strongly connected with the smoker's daily experience? And again, please type them in the chat box to your right.
So some of the responses coming through, break routines, coffee after meals, drinking coffee, break, socializing, coffee,
Great.
stress.
Yes, great. Now, stress will hold on for a moment. That's it, part of the emotional trigger. But everything else that you guys have just noted is very, very true. So not only during coffee time or socializing when drinking with mates, but also often after a meal. It can often punctuate the day, as you have already highlighted, as Some people smoke in the car, when driving, on the phone, and so on. Now, often what we do know is that these triggers become so automatic, so routine, that often people do them without even thinking. It's like when you're driving home from work or you're driving home from grocery shopping. It's so routine, it's so familiar, you can do it with your eyes closed because it's so much part of what you do every day. It's the same with smoking and these habitual triggers. They often happen so unconsciously that most smokers don't even realize that they're smoking with these particular triggers in mind. So that's the habitual triggers. Let's have a look at some of these emotional triggers where smoking is linked in with certain feelings and moods. You've talked about stress. What else could be an emotional trigger for a smoker? How are we going, Stephanie? Any responses?
So responses that are coming through include traumatic event, happy event, anxiety.
Yes. Yep. Great. You've nailed them again. You're excellent, guys. Absolutely. It could be very much a stressful or traumatic event. It could also be a happy event. Maybe their footy team has won the grand final, now they're going to celebrate. Maybe their daughter's getting married. Maybe they've proposed and their partner has said yes. Often, yes, it's very much negative emotions, so smokers are feeling some anxiety, some nervousness, they might be feeling angry about a particular situation, and will often smoke to help them cope with a range of emotions. And when we're working with smokers, it's really important that they identify these triggers, that they are able to peel the onion. Because if they are quitting and are experiencing stress or sadness or anxiety, how will they cope without smoking? We need to help them put some effective strategies in place to help them stay quit and stay smoke-free in the long run. So what can we do? How can we help smokers with these triggers? Well, firstly, we ask smokers to think about recording each and every cigarette that they're having. So there's some examples there on the handout which is provided for you to download. So for example, 10 a.m. coffee break at work. What were they thinking? They might have said, I deserve it. I've been working hard. How are they feeling? Quite happy and relaxed. And we ask them to rate how strong is that craving out of 10, where 10 is I need to smoke this cigarette right now. But we've also asked them to start thinking about alternative coping strategies. What else could you do instead of smoking at 10 o'clock tea time? What else could you do at 2 p.m. when you're bored because you're cleaning at home on a Saturday afternoon? Or what could you be doing at 4 p.m. when you're stuck in traffic and you're running late for your dental appointment? What else could you be doing? How can you help cope with that trigger? So if smokers can identify when they're smoking, and I encourage smokers to fill this out during a work day or a weekday and also over the weekend, because often smoking does change over the weekend. And once they've had a go at recording their smoking triggers, I then ask them to think about, well, what else can you do? You really want to give up smoking, but obviously you've highlighted stress as an important factor for you. Or what I've noted on your record sheet is that boredom keeps popping up for you, and so on. Now this handout over the page has a list of additional feelings, because often people find it difficult to describe how they're feeling, and if we can nail the feeling, then we can start to identify some strategies and put some effective strategies in place. Most smokers who successfully quit because I understand their triggers and have put some strategies that are right for them. Okay, so let's keep moving by focusing on another aspect of planning, and this is making the decision to stop smoking. We know that for a lot of smokers, they will often go through a series of stages of change. And this stages of change model was developed by two psychologists, Francesca and Di Clementi, who worked with many hundreds and hundreds of patients who had a range of addictions, not just smoking, a range of addictions. And what they found was that people typically cycled through a series of stages. So your smoking clients may be at any of these stages. They may be here in this pre-contemplation phase, and they may be saying, I'm not interested in quitting. I don't want to talk about it. And we'll talk about how you can work with someone like that in a moment. They may be thinking about quitting. They may be saying to you, yes, I think it's time, or I've been thinking about it for a while, or I've noticed that it's affecting my fitness and I'm not as fit as I used to be. So they start thinking about quitting. We know that most smokers are in this stage. They're thinking about it, and they can be thinking about it, unfortunately, for a very long time. And I often call these smokers chronic contemplators because they're thinking about quitting for years. It's important that when we're working with smokers that we encourage them to start planning. We encourage them gently to move from contemplation into preparation, and we start putting some plans in place. And that might be thinking about what else they could do instead of smoking. It might be speaking to their doctor about the patches, because now they're available in the pharmaceutical benefit scheme and they're a lot cheaper. We then encourage them to have a go for a day, a few hours. How long can they go for without smoking? And if they can maintain for more than 6 months, they will often come off this cycle. But we know from research and from experience that most smokers will relapse, that they will try time and time again. And we'll talk about relapse in a moment. So having a look at the stages of change model, think about your clients and where they're at. Think about whether the majority of them are here or here. If they are here, there might be some ambivalence there or denial, and we'll talk about how you can work with this type of person in a moment. But they may be here. And if they are here, what might happen is they, instead of moving from relapse to planning, they may move from relapse to no longer thinking about quitting. So we really want to engage in the conversation at this stage of change. How many attempts do you think it takes on average for a person to finally quit smoking? Just have a think about that and put your answers in the chat box. Do you think it takes a few attempts on average, or a lot longer than that? What's your experience working with smokers or thinking about loved ones who have quit time and time again?
So,
How long do you think it takes?
responses coming through, Stav, include
Yeah.
three to six, up to 10.
Yep. Great. Good. Well, initially, yes, we said between 3 to 7 attempts. More recent research was suggesting 14 attempts, and even some of the latest research is suggesting up to 20 times, that it may take a smoker 20 times of trying before they finally give up. Now, I might be very careful about sharing that information with my smoking client. I don't want to put them offside. I don't want them to lose hope. What I do want them to think about is that it is a normal part of the quitting process to relapse, and if they do, to not be so hard on themselves. So I want smokers to think about why are they relapsing, because often what happens is that they use a slip-up as a reason to return to full-time smoking. And this means they've quit for a period of time, and then something happens, or someone offers them a cigarette or two, and they have a few puffs, they smoke the one or two. Some smokers will say, oh my gosh, no, I don't want to do this, and they go back to quitting. But for most smokers, what happens is they will have a slip up, and then they return to full-time smoking. What we really want to encourage smokers is to not use a slip-up as the reason to go back, and to think about not having failed. They are not a failure. They are not hopeless. They are not useless. This is a strong addiction with entrenched habitual and emotional triggers. So we want smokers to think about this as a learning opportunity, to think about why they've slipped up or relapsed, and think about what else they could do instead. Review their reasons. It's really important to help them, motivate them to stay on track. It's also important to check in with them with regards to high-risk situations. And a high-risk situation could be a death in the family. It could be a stressful event at work where you've gone into damage control, or it could possibly be having a car accident, or maybe it's Christmas Day when you're getting together with all the rellos who all smoke and you haven't seen in years. So just have a conversation about what high risk means for them. The important part of quitting, as I've mentioned, is making the decision, but most smokers will experience some inner conflict between wanting to smoke and wanting to quit. This can be quite painful and can often lead to smokers feeling angry, in denial and resistant. And often this resistance is projected towards you, the helper. So don't take this personally if you're finding that smokers are projecting some resistance. What smokers are often experiencing is this devil and angel conversation. I must quit. It's affecting my health. It's expensive. But then on the downside, oh, come on, it helps me relax. I'll just have one. It's really not that bad. I've got good genes. And so they're trying to find those reasons to keep on smoking. And this is where this internal conflict happens. It's too hard. I don't want to discuss it. Leave me alone. A good way of overcoming this ambivalence is working with your clients and asking them about their reasons for smoking and their reasons for quitting. And I've just quickly jotted down some of their reasons for smoking, which you've already highlighted in our previous answered previous questions, and also thinking about their reasons for quitting. And it could be health, it could be dollars, it could be they want clean teeth. But sometimes health and dollars isn't enough, and we need to really focus on what more about health will motivate them to stop smoking. We need to be as specific as possible. And they might say, well, I want to get my fitness back. I want to be able to run. I want to be able to no longer cough and sound like an old woman or old man. Whatever the reason is for them, it's important that we really encourage and focus on that. For some people, it's not about health. It is very much about money. So if it is about money, ask them to think about what they could spend their money on. In the short term, it could be a CD or some apps, phone apps. In the long term, yes, it could be a holiday or an overseas trip, or possibly going to see someone in concert or in theatre. And again, this handout is available, and I encourage you to work with your clients if you have the time, exploring their reasons for smoking and their reasons for quitting. And if you don't have time, ask them to go away and reflect on what's important for them. And this may help with this ambivalence and may help to motivate them to take the next step. Okay. So we've looked at understanding smoking behaviour, we've looked at understanding addiction and the stages of change and this internal conflict. So let's now quickly look at how we can engage in the smoking conversation. Now this is what might typically happen in practice. This is what you might be thinking when you're working with your smoking staff member or client. I've told him before, he probably doesn't want to hear it again. I don't want to upset him. I should say something, but I just don't have the time. I'm not sure about these smoking cessation treatments. Do the patches even work? It's down to willpower. There's nothing I can do. And gosh, this is awkward. I really don't know what to say to him. So you're struggling to actually engage in conversation. We'll talk about the framework, which will help you overcome all these barriers which most professionals face. So this is what you might be thinking, but what about your client? What are they thinking? They might be thinking, oh gosh, I hope everything's okay. I wonder if she's going to ask me about my smoking. I'm sure she will, but what will I say? She'll probably tell me to just quit. If only it was that easy. If she doesn't ask, does she even care? And absolutely, you do care. You're in the helping profession, you want to engage with your client, you want to support them along their quitting journey. So let's have a look at how you can make a difference through the 5 A's framework. Now this is an international model that has been developed all across the globe, is used by a range of professionals to support their clients through the quitting process. The good thing about this model is that it is considered brief intervention, which means that you can work through the 5 A's quite quickly within 3 to 5 minutes. There are now a number of options available. The A's have been tailored to suit particular settings. So for example, the 3 A's are used by the National Health Service in the UK, but also Quit Victoria. ABC is a New Zealand model, and ABCD was trialled in Victoria as part of a hospital and dental project. But it really depends on you and your setting. So I'll take you through each of the A's very quickly, and then you can tailor it according to your setting. The first question is an obvious one. We ask all our clients about our smoking, and you might do this as a part of a questionnaire. You might just specifically ask them, how are you going with your smoking? How much are you smoking? How long have you been smoking? And so on. So all we're aiming to do here is gather as much data so we can provide the most appropriate response. So we ask all smokers about their smoking. Asking shows that we care, and as I've highlighted, the more you engaged, the more likely they are to make attempts. If they're not ready to change, don't be discouraged. Just keep engaging in the conversation, as it may help future change. So we keep tobacco on the agenda, and we all constantly check in, acknowledging our duty of care, but also acknowledging that we care about this person and we want to support them and help them when they're ready. So the first A is to ask. The second A is to assess their readiness. So how do they feel about their smoking? Do they want to quit right now? We also assess their nicotine dependency, whether they smoke first thing in the morning or how many they smoke per day and so on. So we're assessing their stages of change so we can provide appropriate information. But having just said that, you don't necessarily need to assess readiness. Some practitioners are not even assessing at all, because what we do know is that smokers who are not ready to quit will often accept treatment if offered, as highlighted by this slide by Dr. Hayden McRobbie. So even if people are not ready to quit and you offer some assistance and some support, this can engage them to have a go with their quitting and encourages them to think about stopping. The third A is to advise them to have a go, advise them based on the health effects of smoking, that this is the best thing that they can do for their own health. And acknowledging that the smoker is aware of the risks, we keep this information brief and simple, and we personalise it according to their particular condition. So for example, if they have diabetes, we'll link in smoking with their diabetes. If they're pregnant, we'll discuss how smoking affects their pregnancy and so on. The fourth A is to assist, and this will depend on your time and your capacity. You may just assist by referring on to the quit line, and that's okay. That's fine. There are actually faxed referral forms which you can download from the websites, which I'll highlight in a moment, and all you need to do is engage in those first few A's and then refer on. If you do have some additional time, you may wish to assist them with their quit plan, so how they will quit and how they will deal with their concerns, what strategies they will put in place, and so on. Or you might even be able to provide more in-depth support. And this link I have available in the website's handout, which provides you with further detail on what you could do or how you could tailor your information according to your client's stage of change. So again, due to time constraints, I'm not going to spend a lot of time here. However, if you do have a window of opportunity, just be very gentle, explore their reasons for smoking, discuss any concerns, highlight the benefits, and acknowledge that new skills and coping strategies can be learned. Just keep the conversation brief and encourage them to come back to you when they're ready. And the final A is to check in with again at the next visit, or pretty much ask them next time you see them, how are you going? How do you feel about your smoking? Have you had a chance to think about what we discussed last time? Did you fill out the cravings record? What was that like for you? And again, you may make adjustments to your counselling, continue to engage in the A's, or refer on to the quit line. So the 5 A's are to ask, assess, advise, assist, and the final A is to ask again. Again, you can tailor this according to your setting, according to your practice. You may ask about their smoking, encourage them to quit, and follow through by referring them to the quit line. What also helps smokers succeed just very quickly is support and also the use of quitting medications. Let's have a look at the medications which are available both over the counter as well as prescription medications. With the nicotine patch plus the prescription medications, they are available at a reduced cost through the pharmaceutical benefit scheme, so do encourage your smoking staff or clients to speak to their doctor. Due to time constraints, I'm not going to go into a lot of detail about the meds, but what I do want to highlight is that they can double to triple your chance of quitting success. So do encourage your clients to give these medications a go. And if they receive support from you, an educator, the quit line counsellor, a doctor, some form of professional, this will further increase their chances of success. If they are using NRT, nicotine replacement therapy, what I want to highlight here is that they use the product that is right for them and they use it correctly. Often smokers use these products incorrectly, and often it is the main reason why these products don't work. As a minimum, we encourage smokers to use these products for between 8 to 10 weeks as a minimum to help them remain smoke-free in the long term. What is also recommended is combination therapy, and what this means is that they wear the patch and they also take some form of oral NRT. So the patch and nicotine gum, the patch and the nicotine lozenge, the patch and the inhalator, for example, and this will further increase their chances of success. In terms of the prescription medications, you do need a doctor's prescription, so they do need to speak to their doctor about any mental health conditions. There is no nicotine in both these products, and both these products reduce the urge to have a cigarette. With Champix, varenicline, which is the latest product on the market, it is available for up to 24 weeks per year on the PBS. It is one of the most effective forms of quitting medications currently on the market to help people stop smoking. Yes, there are a number of side effects, which I don't have time to go into now, but do speak to your doctor and encourage your clients to speak to their doctor if they're interested about using this medication. And I say to all smokers on any form of medication, if you're not feeling well, if you're experiencing mood changes or physical changes, stop the meds and see your doctor immediately. Other therapies include acupuncture and hypnotherapy. Not enough strong evidence to recommend these methods. Of course, we all know someone who has quit successfully with these methods, but from an evidence-based perspective, we don't recommend them because there's not enough strong evidence. The same with electronic cigarettes, which have currently grown in the market, but they have not been approved by the Therapeutic Goods Administration in Australia. The nicotine e-cigarettes are considered illegal in Australia, and this is because we don't know the safety of these products. We do know from the research that they can contain or release unreliable toxins and carcinogens. There is not enough strong evidence to suggest that these help people to stop smoking. Sure, they are safer than continuing to smoke, but as the research is still growing in this area, I encourage smokers to use the other medications before they try these products, or if they are using these products, that they're using them at their own risk. So just to finish off with support services, the Quit Line is an excellent resource. I do encourage you to encourage clients to ring the Quit Line. They can speak to a professional counsellor trained in smoking cessation, but also has expertise in working with cardiac patients, working with patients who have a mental illness, people who are pregnant, and so on. A callback service is available where counsellors can call back their client and provide that ongoing support and encouragement. Websites and resources are available as well. These are available from the Commonwealth, free posters. The green brochure on the right is for those patients or clients who have a mental health condition. It is a very good resource, free of charge from Quitline or the Quit Now website, which is also available in the handout that is available for you to download. In terms of websites, there's heaps of information online, either Quit Tasmania, Quit Victoria, New South Wales, I Can Quit. So much information to download for you and your clients. The Quit Coach is an interactive website where smokers can answer a series of questions, and then tailored information is emailed to them according to their stage of change. It's very relevant and appropriate. And the Quit Now is the Commonwealth website, which provides a number of free apps to support smokers along their quitting journey. They share motivational messages, they highlight how much money you're saving, they highlight how many cigarettes you've not smoked and how your health is improving. Other useful websites include Mind Health Connect, which is a website focusing on mental health issues. It's a very good resource. The Think Health Wellbeing website is my website, where we run or provide a range of information through our blogs. We also have a free newsletter, and if you're interested, don't hesitate to get online and register your details. And we also have a Facebook page if you want to be kept up to date on a range of health and wellbeing topics, not just smoking cessation. So in summary, I've given you a whiz-bang tour of supporting smokers through the quitting process, acknowledging the important role you play, acknowledging the importance of understanding smoking behaviour, how to engage clients with the 5 A's framework, and the importance of referring to the Quit Line. We looked at the various medications briefly, including electronic cigarettes, and where you can go to for further information and support. I have gone a little bit over time, so my apologies. There's so much more that I wish to share with you, but I hope I've given you some food for thought. If you do want further information, please don't hesitate to get in touch with me. I do run training sessions on site and would be very happy to come along and present on quitting smoking or any other health and wellbeing topic. Thank you so much for coming along, guys. My apologies for going over a few minutes, but I hope you found today's webinar useful.
All right.
Thank you, Stephanie.
Thank you. Thank you very much, Stav. Look, if anyone does have any final questions that they wanted to send through, please do. Just while that may be happening, I'll just run through some of the information that I ran through at the start of the webinar. So the webinar has been recorded. It will be available on the WorkSafe Month site after WorkSafe Tasmania month ends. That again will be done progressively, so please do bear with us while we go through and make all those webinars web accessible. Please do have a look at the program of events, see what other webinars and events we do have coming up this week and the next couple of weeks. WorkSafe month ends on the 30th of October, so there's still time to register for any of the free events that we are running. And with no questions having come through, I certainly do thank you, Stav, for doing this afternoon's presentation, engaging in the smoking conversation and helping smokers quit. So on behalf of WorkSafe Tasmania and our presenter today, we thank everyone for hooking in, and we hope that you have a good rest of the day. Thank you.